October is Breast Cancer Awareness Month. According to the American Cancer Society, women have a 1 in 8 chance of being diagnosed with breast cancer. Joining us now with information on how they're helping patients in the East Bay is Tina Fernandez-Steckler, the Executive Director of HERS Breast Cancer Foundation. Tina, thank you for joining us today.
Thanks so much for having me.
Talk to us about what the HERS Breast Cancer Foundation is all about and how they are helping patients in the East Bay specifically.
Yes, thanks for asking. It's a wonderful organization that has been providing post-surgical products and support services for breast cancer survivors for over 23 years now. It's a wonderful organization, and we are a nonprofit, so we do operate several assistance programs that support patients who are underserved, meaning those who are low income, underinsured, or uninsured. Our programs ensure that those patients receive the same post-surgical products that any other patient would receive for healing, both emotionally and physically.
Now, there are a lot of months that, shed light on various, ailments and things. There's Mental Health Awareness Month. There's Alzheimer's Awareness Month. Why is it important that people know about the dangers and are made aware about the dangers of breast cancer?
Well, as you said, there are a lot of awareness months. And as you said also earlier, 1 in 8 women will be diagnosed with breast cancer in their lifetime. For men, the rate is far different, but men still get breast cancer as well. The rate is, I think, 1 in 970 men or so. So this is a very pervasive disease. It's very devastating. What we've seen with COVID is that a lot of patients put off. They were either not able to get in for their mammograms, or if they had an area of concern with their breasts. And so we are seeing quite a few patients coming in after lumpectomy or mastectomy surgery. So it's a pervasive disease. It's really important to get your mammogram. October is a month to remember to do that. We see it as a form of self-care. It's also important to honor loved ones who may be no longer with us and to support survivors. There are lots of ways that we can do that.
I know breast cancer is one that you hear a lot amongst women. My paternal grandmother passed long ago because of it. My mom had a lumpectomy, and I know there's always the physical aspect of being diagnosed with cancer. Obviously, your body is fighting the cancer, but a lot of the diagnosis, or a lot of it comes with a mental aspect as well. Processing a diagnosis, a cancer diagnosis. I know when my mom called me, she couldn't even initially get the words out of her mouth without crying, because it is so scary for the person being diagnosed, for their loved ones. Talk about the mental aspect of it, and someone who's involved in a movement like this, what you see as being the hardest part of it all.
I think for patients, it's typically what changes that can be often drastic to their bodies. Things like, losing a breast or both breasts, going through treatment and losing their hair. It makes patients so often feel very scared, very vulnerable, sometimes angry. We have 3 program locations in the Bay Area: Pleasanton, Fremont, and San Leandro. And at those locations, we have wonderfully compassionate trained breast care specialists who are there to walk a patient through addressing those changes that have occurred with their bodies, and at the same time just offering a lot of just heartfelt love and warmth. And those are safe spaces. We take as long as a patient needs when they're going through their assessment, and fitting them with products. We carry bras, breast forms, compression garments to combat swelling that happens in the arms and hands when patients have lymph nodes removed, and then the wigs I mentioned before.
There's a recommended age for mammograms for women to start getting checked. What is that age range? When should women get their first mammogram?
It depends on their family history. For some patients, it's in their 30s. For most patients, it's in their 40s. I started having my mammograms about 5 years ago. I just had mine Wednesday, which was a great experience. It's not a comfortable experience, but we know that mammograms save lives. It's very important to get that done. It's also very important to practice self-care by doing your monthly breast exam, self-exam. If you go online, there are lots of great resources, including our website, HERS, H-E-R-S, breastcancerfoundation.org. If we don't have the information that patients are seeking as far as mammograms and things like that, we do have links. And then also in the Bay Area, there are many, many options for breast health medical care.
And you mentioned breast cancer is not just exclusive to women. Men can develop lumps in that region as well. Is there something like a mammogram or some sort of mechanism or way that a man, for example, can test and see if he maybe has developed a lump or anything in that area?
Well, I'm not a physician, but I can report from my readings of it. Most men will develop lumps. They will develop sometimes nipple discharge or discomfort, pain and swelling, and that will encourage them to go to see their physician. What I've also read, and I've talked to medical professionals about this, is that men too often will ignore symptoms and they'll just try to, press through them, and that's very dangerous for many medical conditions, including the risk of breast cancer. So for men that are found to have breast cancer, they also have lumpectomies, they also have mastectomies. Our organization, we do see some male breast cancer survivors. They typically come into our program locations because they need the compression garments to alleviate the swelling and pain that comes from lymphedema, which is caused by lymph node removal or irritation from radiation or treatments like that.
Well, it is October 1st, meaning it is an entire month of breast cancer awareness, really something that we should all be checking for throughout the year. But this is definitely the time to, focus on that and make sure that we are all okay. Tina, is there anything else you want to leave our viewers with?
I do want to mention that this is a big time of fundraising for our organization in particular. We're very small, we're very local. We care for patients all over the Bay Area. We're unique in that we don't turn away patients who might not have be underinsured or uninsured or low income. So please help us get the word out that we're there for patients. You can look us up online. As I said, HERS, H-E-R-S, breastcancerfoundation.org. They can also call 510-790-1911. Also this month, we're having a virtual walk run. Because of COVID, we can't gather in person as we normally do, but that virtual walk run, they can register for it online and walk when and where they can, anytime the month of October, and do their part to support our breast cancer patients. Proceeds go to help support our programs.
And we'll have all of that information on our website as well, so our viewers and our readers can get all of that information. Tina, we really appreciate your time. Thanks for joining us this afternoon.
Thanks for having me.